Hello all. Alright, today our class. Real quick. So maybe we can get through the whole thing. I'm thinking it's probably going to have to be a two-part class. But it is a safety training that we need to do. It's a first aid review. I'm just going over some things, kind of basic things that might happen, and then we're going to find answers at the Mayo Clinic. So you can really look this up at any time. You just go to Google, type in Mayo Clinic first aid, and so we're going to go over some minor injuries that occur sometimes. So we're going to go over blisters, bruises, burns, cuts and scrapes, fever, foreign object in the eye, gastroenteritis, headache, heat exhaustion, nosebleeds, sprains, and toothache. So even just saying that, we're already like a full minute in, so I'm guessing we might have to break this up into two segments. So there's 12 things we're going to go over, so we'll go over 6 of them today, and then 6 of them tomorrow. Unless for some reason the Mayo Clinic is very short on what you're supposed to do with each. Okay, so I'm going to go to the Mayo Clinic. And the first thing we have is blisters. Alright. First aid when it comes to blisters. So if a blister isn't too painful, you want to keep it intact. So unbroken skin over a blister may provide a natural barrier to bacteria and diseases, which help with the risk of infection. If it's just kind of a white or slightly yellowish, not too yellow, mostly white is what you want, then that's actually your body is naturally trying to heal that burn by putting that on there. So you don't want to pop that. Now if it turns green or something, you definitely want to pop that. That means it's infected. So cover it with a bandage or moleskin. Cut a piece of the moleskin into a donut shape and place the pad that encircles and protects the blister. Then cover the blister and moleskin with gauze. And then again, seek medical attention if it looks infected. If you have diabetes or poor circulation, call your doctor before treating the blister yourself. Okay, so how to drain a blister. 1. Wash your hands and the blister with soap and warm water. Swab the blister with iodine, if you have some. Clean a sharp needle with rubbing alcohol. Use the needle to prick the blister in several spots near the edge. Not too deep, obviously. Let the fluid drain, but leave the overlying skin in place. Apply an ointment such as petroleum jelly to the blister and cover it with a non-stick gauze bandage. If a rash appears, stop using the ointment. Neosporin is also very good. I use that for pretty much any cut or anything, and honestly, it is magical. Follow-up care, check the area every day for infection. After several days, use tweezers and scissors that are sterilized with rubbing alcohol to cut away the dead skin and apply more ointment to the bandage. And then in a couple of days, that thing should be taken care of. So blister prevention. To prevent friction blisters on your feet, wear shoes that fit well. It also helps to use moisture wicking socks. Try the various socks, shoes, and insoles that are designed specifically to help reduce blistering. You might also try attaching moleskin to the inside of your shoes where it might rub. Or you can dust the inside of your socks with foot powder. Gloves help prevent blisters on your hands. Okay, so that is blisters. Now we're going to move on to bruises and first aid. Pardon. So how to administer first aid for a bruise. So a bruise forms when a blow breaks blood vessels near your skin's surface. So allowing a small surface of blood to leak into the tissues under your skin. So that's all it is when you get a bruise, it means you hit it hard enough that you're bleeding underneath your skin and it's kind of coagulating there. The trapped blood may cause a bruise that at first looks like a black and blue mark and then changes color as it heals. It just gets lighter. And you can enhance bruise healing with a few simple techniques. So what you want to remember is the acronym RICE for rest, ice, compression, and elevate. So rest the bruised area if possible. Some places easier than others to rest a bruise. Ice the bruise with an ice pack wrapped in a towel. Leave it in. And why in a towel? Because you don't want to get a what is it called? A burn, a freezer burn. Because you can get that. Sometimes if it's so cold, the ice pack it'll adhere to your skin, and that's really not good for your skin. So that's why you wrap it in a towel. Leave it in place for 10 to 20 minutes. Repeat several times a day for a day or two as needed. C. Compress the bruised area if it is swelling using an elastic bandage, but don't make it too tight. You don't want to tourniquet it. If your arm starts swelling up and turning a different color, it's way too tight. Just lightly wrap it. And even a gauze bandage, or I think that's, yeah, I think it is. Well, is it gauze? I can't remember the name of it. Sorry, I'm not helping. But something that, like you wrap your foot in if you injure it. It is not exactly gauze. I can't remember the name of it right now. Sorry, anyway. And then elevate the injured area. So there might be reasons to consult your doctor if you notice very painful swelling in the bruised area, are still experiencing pain 3 days after a seemingly minor injury, have frequent large or painful bruises, particularly if bruises appear on your trunk, back, or face, seem to develop for no known reasons, have easy bruising and a history of significant bleeding, such as a surgical procedure, notice a lump or a hematoma form over the bruise, or are experiencing abnormal bleeding elsewhere, such as from your nose or gums, or suddenly begin bruising, but have no history of bruising, and finally have a family history of easy bruising or bleeding. So, that is the fun FYI on bruises in first aid. So we've got through 2, we've got 4 more to go. So our next one is burns. Okay, this one might be a bit longer. Again, blisters will help with burns. So burns are tissue damage from hot liquids, the sun's, flames, chemicals, electricity, steam, and other causes. Kitchen-related injuries from hot drinks, soups, and microwave foods are common among children. Major burns need emergency medical help. Minor burns can usually be treated with first aid. So when to seek emergency care? It's usually pretty obvious when it comes to a burn, but it's best that we go over it. Call 911 because some people will tough things out and they really shouldn't, because you could be doing long-term damage that you shouldn't do. So call 911 or seek immediate care for major burns, which are deep, involving layers of the skin, cause the skin to be dry and leathery, may appear charred or have patches of white, brown, or black, are larger than 3 inches, so about 8 centimeters in diameter, cover the hands, feet, face, groin, buttocks, or a major point of, or a major joint, or encircles an arm or a leg. Oh, really bad stuff. Are accompanied by smoke inhalation, or begin swelling very quickly. So electrical burns, including those caused by lightning, and major chemical burns need emergency medical care. A minor burn might need emergency care if it affects the eyes, mouth, hands, or genital areas. Babies and older adults might need emergency care for minor burns as well. So treating major burns. So protect the burned person from further harm. If you can do, and this is what you do until emergency helps arrive. Protect the burned person from further harm. If you can do so safely, make sure the person you're helping is not in contact with the source of the burn. For electrical burns, make sure the power source is off before you approach the burned person, because then you could get it too. And don't try to remove clothing stuck to the burn. No, that's just going to rip it off, and it's going to make it worse. You don't want to see that either. Let the professionals deal with that. Make certain that the person burned is breathing. If needed, begin rescue breathing if you know how. Remove jewelry, belts, and other tight items, especially from the burned area and the neck. Burned areas swell quickly. So cover the burn. Loosely cover the area with a gauze or a clean cloth. Raise the burned area, so if it's on your arm, you're going to want to raise it up. If it's on the leg, you're going to want to lie down. And lift the wound above the heart level if possible. And of course, lastly, is you want to watch for signs of shock, which include cool, clammy skin, weak pulse, or really shallow breathing. Shallow breathing just means they're not really breathing regularly, just really. That is a sign of shock, and you don't want that. And then for minor burns, this is how you treat them. Cool the burn. So say you spilled soup on your arm or something, you want to cool the burn. So hold the area under cool, not cold, running water for about 10 minutes. If the burn is on the face, apply a cool, wet cloth until the pain eases. For a mouth burn from hot food or drink, put a piece of ice in the mouth for a few minutes. And I think ice is better for the mouth because it's going to create kind of a cool steam, because your mouth is really hot as it is, especially when it's closed. Remove rings or other tight items from the burned area. So try to do this quickly and gently before the area swells, because once it swells, unless you have something to cut it off, you're just going to have to wait till it goes down, but you might have to cut the ring off. Don't break blisters. Again, we already went over blisters. Blisters help. Apply lotion. After the burn is cooled, apply a lotion such as one with aloe vera or cocoa butter. Yeah, aloe vera is very good. This helps prevent drying and provides relief. Bandage the burn. Cover the burn with a clean bandage. Wrap it loosely to avoid putting pressure on the burned skin. Bandaging keeps air off the area, reduces pain, and protects blistered skin. And if needed, take a non-prescription pain reliever, such as ibuprofen, Advil, Motrin, naproxen sodium, which is Aleve, or acetaminophen, which is Tylenol, and others. All right. Boom, 3 down, 3 to go for the first part. Okay, cuts and scrapes. All right, cuts and scrapes. So these guidelines can help you care for minor cuts and scrapes. So wash your hand. This helps avoid infection. Stop the bleeding. Minor cuts and scrapes usually stop bleeding on their own. If needed, apply gentle pressure with a clean bandage or cloth and elevate the wound until the bleeding stops. Clean the wound is third. Rinse the wound with water. Keeping the wound under running tap water will reduce the risk of infection. Wash around the wound with soap. Don't get soap in the wound. And don't use hydrogen peroxide or iodine, which can be irritating. So remove any dirt or debris with tweezers, cleaned with alcohol. See a doctor if you can't remove all the debris. I've got a gross story, but I won't tell you because we don't have time. And then you want to apply an antibiotic or petroleum jelly. So again, I go with Neosporin. Apply a thin layer of antibiotic ointment or petroleum jelly to keep the surface moist and prevent scarring. Certain ingredients in some ointments can cause mild rash in some people. If a rash appears, stop using the ointment. Then you want to cover the wound with rolled gauze held in place with paper tape. Covering the wound keeps it clean. And if the injury is just a minor scrape or scratch, leave it uncovered, because it'll heal on its own. You can still put a little bit of Neosporin on or something like that. And then if it is, kind of a deeper one, you want to change the dressing. Do this at least once a day or whenever the bandage becomes wet or dirty. Depending on how far down it goes and how rusty it was, whatever cut you want to get a tetanus shot if you haven't had one in the past 5 years and the wound is deep or dirty. So yes, because you don't want to get lockjaw. And watch for signs of infection. See a doctor if you see signs of infection on the skin or near the wound, such as redness, increasing pain, drainage, warmth, or swelling. All right. Next, Hey, we're going to go to fever. I need more cowbell. Okay. A fever is a rise in temperature in the body. It's usually a sign of infection. The fever itself is generally harmless and probably helpful, burning something off. Fevers usually don't need a treatment. So average body temp is 98.6 degrees Fahrenheit or 37 degrees Celsius. But a normal body temperature can range between 97 degrees and 99 degrees Fahrenheit or more. Your body temperature can vary depending on how active you are during the day, and generally older people have lower body temperatures than younger people. So the following thermometer readings generally indicate a fever. So if you do one rectally, which I haven't done since I was jabbed, ear or temporal artery temperatures of 100.4 or higher, oral temperature of 100 degrees Fahrenheit or higher, or armpit of 99 degrees or higher. Should I treat a fever? So if your child is sick, the main goal is to relieve discomfort and promote rest. Treating a fever neither shortens nor particularly prolongs the course of the illness. So treating fever for an adult. Adults with fevers of 103 degrees Fahrenheit or higher will generally look and act sick. The main goal of treatment is to relieve discomfort and help you get rest. To treat a fever at home, drink plenty of fluids to stay hydrated, water, not soda, or such. Dress in lightweight clothing. Use a blanket if you feel chilled until the chills end. Take acetaminophen, Tylenol and others, or ibuprofen, Advil, Motrin, and make sure you follow the directions on the label. When should you seek medical advice for an adult? Well, if you have difficulty breathing, chest pain, severe headache, confusion, or agitation. This is your abdomen area right down here. If you have abdominal pain, that might be a reason. Repeated vomiting, dry mouth, decreased or dark urine, or refusal to drink fluids, which may indicate dehydration, skin rashes, difficulty swallowing fluids, pain with urination or pain in the back, and when to seek emergency care. If you have a fever and you're not sweating, you have a severe headache, you start to have seizures, that's a sure sign you need to go see a medical. You have a stiff neck, confusion, repeated vomiting or diarrhea, and nothing stays down. Irritability or significant discomfort, any worrisome or different or unusual symptoms. Okay, so there you go. That is first aid for a fever and what you should do and when you really need to, get checked. Okay, so our last one is foreign object in the eye. You have all sorts of foreign objects in your ear. Okay, so if you get a foreign object in your eye, wash your hands with soap and water. Try to flush out your eye with a gentle stream of water, of clean, warm water, Use an eye cup or a small drinking glass positioned with its rim resting above the bone. So you're just going to put it over. It's just something that's going to fit your eye socket with water and not have water spill out everywhere. And you're going to have to open up your eye. Another way to flush a foreign object from your eye is to get in a shower and aim the gentle stream of lukewarm water on your forehead over the affected eye while holding your eyelid open. So you want to go like that. If you're wearing contact lenses, it's best to remove the lens before or while you're irrigating. Could be irritating. Irrigating is just flushing it out. That's what irrigation is. While you're irrigating the surface of the eye with water, sometimes a foreign body can be stuck in the undersurface of the lens. And also, if you have your contacts in, it might have just been lodged into you, and taking your contact out might actually help dislodge whatever's in there. Now, to help somebody else. So wash your hands with soap and water. Seat the person in a well-lighted area. Gently examine the eye to find the object. Pull the lower lid down and ask the person to look up. So, just the whole. But you want to, it might turn a little red as you do that. So you're going to be looking for something that's not red, hopefully. If the object is floating in the tear film on the surface of the eye, try using a medicine dropper filled with clean warm water to flush it out, so if you have one. Or tilt the head back and irrigate the surface of the eye with clean water from a drinking glass or a gentle stream of tap water, and you're going to have to keep their eye open. People might struggle with this, but just remind them that you're trying to help, and it's better to try to help than just leave something in your eye. Caution, don't try to remove an object that's embedded in the eye. It's stuck. Don't rub the eye because you might be rubbing it in further. Don't remove a large object that appears to be embedded in the eye or is sticking out between the lids. Yeah, that's when, okay. And we'll go from the caution to when to seek emergency care. So you seek emergency care when you can't remove the object with simple irrigation. The object is embedded in the eye. The person with the object in the eye is experiencing abnormal vision, like double vision or blurred vision. Pain, redness, or sensation of an object if the eye persists more than 24 hours after the object is removed. Keep in mind that sometimes an object can scratch your eye. This often feels as though the object is still in the eye even after the object has been removed. This sensation can sometimes take 24 hours to go away. I've had that before. I've got many things in my eye. Okay, well, that's it for today, everyone. We will do part 2 tomorrow. Ciao for now, and I'll see you then. Bye.